Bismillahirrahmanirrahim. Quote of the day is from Quran that do not lose hope nor be sad. Today the topic of my presentation is hepatitis C and I am presenting it under the supervision of Professor Dr. Saira Afzal. Learning outlines. Learning outlines of the presentation are introduction of the disease, epidemiological triad, mode of transmission, levels of prevention, vaccinations, and recent updates. Learning outcome. At the end of this presentation, participants will be able to describe about the introduction, epidemiological triad, mode of transmission, clinical features, level of prevention, along with recent updates. Case presentation. A 57 years old male with a body weight of 84 kg and height of about 1.6 meter, former IV drug user and alcohol drinker, but clean and sober for 7 years. There is no history of tobacco use, works in repairing wheelchairs and scooters, married for 2 children, living in underprivileged part of Islamabad, has a history of generalized pain, fatigue and fever for past 6 months, along with the distension of abdomen and shortness of breath. He was diagnosed with HCV infection in 2015. He is not sure when he contracted it. He does not remember having any symptoms related to the infection at that time. The patient's medical history was not significant except for the dental surgery and few surgical stitches. His lab results show total bilirubin about 1.6, AST about 65, ALT 115, serum bilirubin was 2.5, PT hepatit were deranged slightly, that is 18 and 40. INR was 1.7 and anti-HCV test was positive. Now, differential diagnosis for this case can be first is hepatitis C, second is non-alcoholic fatty liver disease, then hepatitis A, hepatitis B, hepatitis D. Drug-induced liver injury can be a cause, hemochromatosis, hepatocellular carcinoma, and Wilson's disease. Introduction of the disease. Hepatitis C is a contagious liver disease that results from the infection with hepatitis C virus. It can range in severity from mild illness lasting a few weeks to a serious lifelong illness. It is among the most common viruses that infect the liver, and it has been shown to be a major cause of parentally transmitted hepatitis. The hepatitis virus is a small enveloped positive single-stranded RNA virus of the family Flaviviridae. The hepatitis C virus is the cause of hepatitis C and some cancers such as liver cancer and lymphomas in humans. The picture shows hepatitis C virus and how it's enveloped. Problem statement is that every year about 3.4 million people are infected with hepatitis C virus. About 130 to 150 million people are chronically infected and at the risk of developing liver cirrhosis or liver cancer. More than 5 lakh people die from hepatitis C related liver disease every year. Based on CDC estimates, 2.4 million persons are living with active HCV infection, corresponding to 1% HCV prevalence among the adult population in the United States. This picture shows that how hepatitis infections are constantly increasing throughout the year from 2010 to 15, and that given limited testing and underreporting, CDC estimates the actual number of Americans newly infected is 34,000. And amongst those, 94% were cured. Pathophysiology of the disease. Hep C virus is a non-cytopathic virus that enters the liver cells and undergoes replication simultaneously, causing cell necrosis by several mechanisms, including immune-mediated cytolysis, in addition to various other phenomena such as hepatic steatosis, oxidative stress, and insulin resistance. This picture also shows pathophysiological factors that are involved in Hep C infection. Epidemiological triad. Agent factor, host factor, environmental factors are described in the next slides. Agent factors, amongst the agent Hep C virus is a spherical enveloped single-stranded RNA belongs to the family Viridae. Reservoir of infection is man is the only reservoir of infection which can be spread either from carriers or from cases. Infective material is contaminated blood is the main source of infection. Although the virus has been found in the body's secretions such as saliva, vaginal secretions, and semen of infected persons. Hep C is not transmitted through breast milk. Resistance of the virus that in culture medium it was found to survive about 37 degrees centigrade and room temperature for 2 and 16 days, respectively. While the virus was relatively stable at 4 degrees centigrade without drastic loss of infectivity for at least 6 weeks. On boiling or cooking food or liquid means meant to be consumed for at least 1 minute at 180 degrees Fahrenheit or 85 degrees centigrade to kill the virus. Period of communicability. The virus is present in the blood during the incubation period for a month before jaundice and an acute phase of the disease. Age. The highest prevalence of HCV infection was age group from 50 to 59. The outcomes are age dependent. High risk groups comprise recipients of blood transfusion, healthcare, laboratory personnel, homosexuals, prostitutes, percutaneous drug abusers, recipient of solid organ transplant, and patients who are immunocompromised. Among the environmental factors, it is seen that cases are present in whole year and whole season. However, the factors that are included are sharing injectable drugs, needle stick injuries, and mother-child transmission. Incubation period is the incubation period for Hep C is 2 weeks to 6 months. The average time period from exposure to symptoms onset is 4 to 12 weeks. That range is from 2 to 24 weeks. Mode of transmission. The hepatitis C virus is most commonly transmitted through exposure to infectious blood. This can occur through reception of contaminated blood transfusion, blood products, or organ transplant, injections given with contaminated syringes, and needle stick injuries in healthcare setting, injection drug use, being born to hepatitis C infected mother. Hepatitis B may be transmitted through sexual contact with an infected person or sharing some personal items of contamination contaminated with infectious blood, but these are less common. Hep C doesn't spread through breast milk, food, or water, or by casual contact, such as sharing food or drinks with an infected person. This shows that how hepatitis C prevails, that new HCV infections leads to death and some leads to treatment cure. However, those who have been cured can get a reinfection and then they add to the pool of infections. Stages of hepatitis C. Hep C virus affects people in different ways and in several stages. First, incubation period. This is the time between first exposure to the start of disease. It can last anywhere from 14 to 80 days, but the average is 45. Acute hepatitis C. This is a short-term illness that lasts for first 6 months after the virus enters the body. After that, some people who have it will get rid of it, clear the virus on their own. Chronic Hep C. For most people who get hepatitis C, up to 85%, the illness moves into a long-lasting stage that is longer than 6 months. This is called chronic Hep C infection and can lead to serious health problems like liver cancers or cirrhosis. The disease leads to inflammation that over time replaces the healthy liver cells with the scar tissues. It usually takes about 20 to 30 years for this to happen, though it can be faster if you think alcohol or you have HIV. Liver cancer. The ongoing infection causes inflammation in the liver. The extended inflammation can cause scarring, that is called cirrhosis, and can ultimately lead to liver cancer. Chronic Hep C increases the risk of non-Hodgkin lymphoma and head and neck cancers. Clinical features of the disease. Loss of appetite, nausea, stomach pain, vomiting, dark urine, fever, fatigue, jaundice, joint pain. Symptoms. Following initial infection, approximately 80% of the people do not exhibit any symptom. Those people who are acutely symptomatic may exhibit fever, fatigue, decreased appetite, nausea, vomiting, abdominal pain, dark urine, gray colored feces, joint pain, and jaundice. About 75 to 85% of the newly infected persons develop chronic disease, and 60 to 70% of the chronically infected people develop chronic liver disease. 5 to 20% develop cirrhosis, and 1 to 5% die from cirrhosis or liver cancer. In 25% of the liver cancer patients, the underlying cause is Hep C. As the liver becomes more severely damaged, more obvious and serious symptoms, that is, telltale signs, can develop, such as yellowing of skin and whites of eye, that is jaundice, swelling in the legs, ankle, and feet, that is caused by buildup of fluid, that is edema, swelling in the abdomen, that is caused by buildup of fluid, that is known as ascites. Diagnosis. The presence of antibodies against Hep C virus indicates the person is or has been infected. The Hep C virus recombinant immunoglobulin assay and Hep C virus RNA testing are used to confirm the diagnosis. Diagnosis of the chronic infection is made when antibodies to the Hep C virus are present in the blood for more than 6 months. Similar to the acute infection, diagnosis is confirmed with an additional test. Specialized tests are often used to evaluate patients for liver disease, including cirrhosis and liver cancer. Anti-HCV antibodies. These are the proteins that your body makes when it finds the Hep C virus in the blood. They usually show up about 12 weeks after infection. It usually takes a few days to weeks to get results. Though a rapid test is available in some places, that is through kit method, the result can be non-reactive or negative. This means that a person does not have Hep C. If a person has been exposed in the last 6 months, that needs to be retested. And if it is reactive or positive, this means that you have Hep C antibodies and you have been infected at some point. You'll need another test to make sure either the disease is active at this stage or not. If your antibody test is positive, you'll get this test. HCV RNA. It measures the number of viral RNA, genetic material from the Hep C virus. That particles of this virus may found in the blood. They usually show up 1 to 2 weeks after a person is being infected. The results can be negative, shows that do not have the disease, and positive means disease is prevailing. LFTs, liver function tests. They measure proteins and enzyme levels, which usually rise 7 to 8 weeks after the infection. As the liver gets damaged, enzyme leak into the bloodstream. But normal enzyme levels can be there and still the patient have Hep C. This shows chronic Hep C level enzymes, that how HCV, anti-HCV levels are increasing, and it shows time in months. SGBT levels always fluctuating in the scenario. 28th July is the World Hepatitis Day, that is for awareness, prevention, and fight of the disease. Primary prevention of the disease. There is no vaccine for Hep C. The risk of infection can be reduced by avoiding unnecessary and unsafe injections, unsafe blood products, unsafe sharp waste collection and disposal, use of drugs, and sharing of injection equipments. Sharing of sharp personal items that may be contaminated with infected blood, tattoos, piercing, and acupuncture performed with contaminated equipment. Secondary and tertiary prevention for people that have been infected with Hep C virus are shown the next. CDC recommendations. CDC now recommends one-time Hep C testing for all adults that are 18 years or older and all pregnant women during every pregnancy. CDC continues to recommend people with risk factors, including people who inject drugs, be tested regularly. Vaccinations. A Hep C vaccine, the vaccine capable of protecting against the Hep C virus, is not yet available. Although the vaccines exist for Hep A and Hepatitis B, development of an HCV vaccine has presented challenges. Vaccine is not currently available, but several vaccines are currently under development. Secondary prevention. Early diagnosis can prevent health problems that may result from infection and prevent transmission to family members and other close contacts. Some countries recommend screening for people who may be at the risk of infection. These include people who receive blood products or organs before screening of Hep C virus was implemented, or where screening was not yet widespread. A current or former injecting drug user, even those who injected drug once many years ago. People on long-term hemodialysis, healthcare workers, people living with HIV, people with abnormal liver test or liver disease, and infant born to infected mother. WHO recommends education and counseling on options for care and treatment, immunization with hepatitis A and B vaccines to prevent co-infection from these hepatitis viruses to protect their liver, early and appropriate medical management, including antiviral therapy if appropriate, and regular monitoring for early diagnosis of chronic liver disease. Treatment. There are 6 genotypes of Hep C, and they may respond differently to the treatment. Careful screening is necessary before starting the treatment to determine the most appropriate approach for the patient. Combination antiviral therapy with interferon and ribavirin has been the mainstay of Hep C treatment. Interferon, peg interferon, and ribavirin that are used to be the main treatments for Hep C. Hep C is treated using direct-acting antiviral tablets. Direct-acting antiviral tablets are the safest and most effective medicine for treating Hep C. They're highly effective in clearing the infection in more than 90% of the people. They can have side effects like fatigue, flu-like symptoms, anemia, skin rash, mild anxiety, depression, nausea, and diarrhea. Certain medications have shown that Zipatile, this once daily pill, has cured the disease in as many as 97% of those who have been treated with the disease. Now, Mevrit, this daily pill offers a shorter treatment cycle of 8 weeks for adult patients with all types of Hep C virus who do not have cirrhosis and who have not already been treated. The treatment is longer for those who are in different disease stage. The prescribed dosage for this medicine is 3 tablets daily. Harvoni. This once daily pill cures the disease in most people in 8 to 12 weeks. The Kiara Park. This treatment is a combo pill. Two that you'll take once a day and one you'll take twice with meals. You'll take it for 12 to 24 weeks. Then is Technivi. You'll take the tablet by mouth, possibly along with ribavirin. Then comes with the Sovaldi with Abelsavir. Take this tablet at the same time every day with food. You have to take it along with the ribavirin or interferon. It will probably be on it for 12 to 24 weeks. No vertical programs. We have a hepatitis C free Punjab with zero deaths that is caused by complications of hepatitis. Goals of the program are the overall goal of the project is to reduce morbidity and mortality due to Hep B and C by working in all focus areas defined in Hepatitis Act 2018. That shows robust surveillance in health facilities, introduction of auto-disabled syringes, registration of barbers and beauty salons, mandatory screening of blood before transfusion, implementation of healthcare waste management in all healthcare facilities, mandatory testing before dialysis, surgeries, and organ transplant, mandatory testing of prisoners within 7 days of incarceration, compulsory hepatitis B vaccination of newborn within 24 hours. Achievements of the program are the program has achieved following milestones. First is the education, prevention, test, and treat. Second, macro elimination through hepatitis clinics. Micro elimination, that is through door-to-door campaign. And fourth, that is achieved that special initiative for universities, colleges, madrasas, and prisons, etc., in collaboration with private stakeholders. Recent updates are treatment as prevention for hepatitis C, a nationwide elimination program in Iceland using direct-acting antiviral agents. This shows that in Hep C program, Iceland is taking a cohesive, multi-programmed approach that includes a scale-up of prevention, testing and early treatment of Hep C in both hospital and community settings. It includes a multidisciplinary public health model of care and cooperation between government, health service, and community organization systems. Another article that is related to the editor that shows socioeconomic factors affecting hepatitis C and lack of awareness. It's a case study in Pakistan. It is clear from the results that the total income of the household increases the chances of hepatitis C decreasing. Patient's history of jaundice, family history of HCV, blood transfusion, sharing this same toilets at the risk of getting that infection. Risk factors are those which have positive impact on Hep C. For example, those who shared patient's toilet has more chances of Hep C. Factors like surgical operations and blood transfusions are mainly concerned with doctors and hospitals, but still people are getting this infection due to these factors. They may be due to negligence of doctors and other pharmaceutical staff or paramedical staff. More than 50% respondents in the view that contaminated water and some other diseases like tension, diabetes, stomach problems, etc., were the main reason of HCV infection, which are wrong. Trend of hepatitis C. This shows among the age groups and throughout the years. That shows from 2019 to 18, the trend is constantly increasing. However, more among the age groups of 50 to 59, and then comes the 40 to 49 years, and it shows that patients that are more younger have the least trend. Coming towards the MCQ session, first MCQ is the recent increase in the new HCV infections have primarily resulted from the ongoing opioid epidemic and associated injection drug use. The disease exists in short-term acute and long-term chronic form. How long does acute hepatitis last? Option A, less than 6 months. Option B, less than 3 months. Option C, about
C,
6 weeks. And option D, about 1 month.
D.
Uh, Option A is the right one, about 6 months, less than 6 months. A person XYZ comes to the infectious disease clinic and finds that he is suffering from Hep C that is caused by hepatitis C virus. On inquiring about the disease, he found that the virus to be transmitted through blood transfusion. The physician told that treatment will act directly on nucleic acid of the virus and the virus will get destroyed. So the nucleic acid that is found in the hepatitis C virus is option A, double-stranded RNA, option B, single-stranded DNA, option C, single-stranded RNA, and option D, double-stranded DNA virus.
B,
C.
A,
Option C is the right one, single-stranded RNA virus. Third MCQ is the hepatitis C virus is the cause of Hep C and some cancers such as liver cancer and lymphomas in humans. Hep C leads to cirrhosis, liver failure when left untreated. A telltale sign of liver disease is option A, hair loss, option B, increased urination, option C, insomnia, and option D, jaundice.
B,
D.
D is the right answer. Jaundice is one of the telltale signs of liver disease. Fourth MCQ is a child who have recovered from Wilson's disease, the disease which involves abnormal copper handling by the liver resulting in copper accumulation in the body and is characterized by abnormalities of the basal ganglia of brain and splenomegaly. Suffering from cirrhosis in adult age of 46 years. In that patient, the most accurately diagnosis in this patient can be done by option A, eye examination, option B, blood test, option C, liver biopsies, and option D, endoscopic ultrasound.
C,
C. D.
Option C is the right one. Liver biopsy is the most accurate and definite way of diagnosing. Fifth MCQ is the liver is the largest solid internal organ, about the size of a football almost. It is located mainly in the right upper portion of the abdomen, beneath the diaphragm. It is one of the vital organs of the body. What important functions are affected by severe acute or chronic liver disease? Option A is blood cell breakdown. Option B, elimination of water and salt as urine. Option C, manufacture of blood protein. And option D, synaptic neurotransmission.
C.
C.
Yes, option C is the right one. Sixth MCQ, a person ABC, about 50 years old, male, presented to OPD with a complaint of pain, abdomen, and fatigue all the time. His labs shows deranged ALT and AST levels, and viral markers shows HCV positive. The safest and most effective medicine for treating Hep C in this patient is option A is direct acting antiviral tablets, option B interferon, option C peg interferon, and option D ribavirin.
A.
Yes, A is the right answer. A seventh MCQ is a highly contagious infection that mostly leads to chronic form can be transferred from one person to the other through multiple ways. Which among the following is the least likely route for this transmission to occur in the case of Hep C virus? Option A, at birth from infected mother. Option B, from fecal oral transmission. Option C, from dental surgeon. Option D, from sexual transmission.
B.
D.
Yes, option B is the right one. Eighth MCQ is John is 39 years old, male, presented with the yellowing of eyes and dark colored urine for past 4 months. On his labs, LFTs were not in limits, and on antibody testing, he was diagnosed as having Hep C virus positive. Which among the following is the best pill for patients that are recently diagnosed and not very good compliance of medicine? Option A is Zepatier, option B is Harvoni, option C is Mefdire, and option D Elbesvir. Option A is the right one. These pills are given for those patients who are recently diagnosed and cirrhosis is not yet developing. Ninth MCQ. A patient having infection of Hep C virus is taking treatment, but he forgets to take the medicine most of the time. He is requesting the physician to provide his medicine that can be taken with food so that the compliance can be good. Which among the following tablets should be given to this patient? Option A is Zepatier, option B is Harvoni, option C Meftier, and option D is Elbasvir. Option D is the right one. This medicine can be given with food so that compliance can be as good as a person wants. A 10th MCQ is child born to a mother who was diagnosed as having Hep C during her pregnancy was given birth via lower segment cesarean section. Now, regarding the nutritional status of the newborn, which among the following is the best to protect him from infections and to boost immunity? Option A is bottle feeding, option B breastfeeding, option C cow milk, and option D soft cereals.
B.
B.
Yes, B is the right one. Breastfeeding because Hep C virus doesn't transmits itself from breast milk. This is the key, and thank you.
Thank you very much, Dr. Isma. Very nice presentation and very